am going to talk about the risk factors of women to develop diabetes. Most of the women who have the following risk factors have every chance of becoming a diabetic in the near future. The risk factors are increased BMI, that is body mass index of more than 23, patients who are overweight, patients who have history of gestational diabetes, patients who have history of dyslipidemia, patients who have a family history of diabetes in their parents or their siblings, patients who have polycystic ovarian disease, and patients who have a pre-diabetes or a cardiovascular event before their pregnancy. Also, gestational diabetes is also a risk factor for developing future diabetes. Today I am going to talk about menopause and diabetes. Patients with diabetes, women with diabetes develop menopause in a premature age. They have a menopause at an earlier age than people who don't have diabetes. Also during the menopause, there will be hormonal changes which will affect the blood sugar levels and cause a lot of fluctuation in the blood sugar levels. There may be loss of control of the blood sugars, and the development of complications can also occur during the menopausal period. Also, the emotional factors of menopause can affect the control of diabetes and make the diabetes worse in patients with diabetes and who are approaching menopause. Today I am going to talk about diabetes in pregnancy. Women with diabetes can become pregnant or may develop diabetes during the period of pregnancy. This type of women who develop diabetes during pregnancy are known as gestational diabetes. The diabetes can be type 1 or type 2 in patients who become pregnant. These patients should have their blood sugars checked properly, and control of the blood sugar is very, very important, because if the patient is having high blood sugar, there is every chance that the patient's baby has lot of congenital malformations like tetralogy of Fallot and various other cardiovascular malformations. Today I am going to talk on diabetes in women. The gender difference in diabetes is almost nothing. Almost equally, both the genders are affected with diabetes. However, women affected with diabetes have a worse prognosis than men affected with diabetes. They have threefold increase in cardiovascular risk factors and twofold risk in renal risk factors for developing complications of diabetes because of diabetes. Also, the hormonal changes during menopause and during pregnancy causes some difficulty in controlling of diabetes.